are you feeling about talking with Ady right now, and what are you most looking forward to your interview with him?
I'm very excited to talk to Ady. He is someone that I have so much respect for. I'm a little nervous to meet him because he is larger than life in many ways because of the extent to which he's had an impact already. He's educated so many policymakers and community members, and I'm just excited to have the conversation with them about what we can do better. Hi.
Hey there. Great to finally meet you. How was your morning?
Busy. Went to an event, made some lunch, and just ate lunch with my dad.
What did you eat?
So I made an Indian dish called Bengan Aloo, which means eggplant and potato. It's a pretty traditional North Indian Punjabi style dish, and one of my dad's favorites.
Pretty delicious. I miss North Indian food so much. Definitely top 3 cuisines in my humble opinion.
I feel lucky that my homegrown food is Indian food. There's no doubt about that.
All of us who follow you on Twitter know you live with your father, Ady Kalra. He seems like a pretty cool dude. Used to cruise around in a 73 Impala and has a magnificent shock of white hair. Tell me about yourself, and him, and what it feels like to grow up to become your father's elected representative.
I know he's proud of me and my brother, given his very humble beginnings. We didn't come from money in India. For his son to be the first Indian American elected in the history of the California legislature, I know it makes him proud, and it's something that I never planned or aspired to. I would not be where I am without him.
My father has been a similarly powerful figure in my life. He has been living here in Santa Barbara for the past 5 months, and it has been incredible to spend time with him, and watch him play with my 2 children, Willow and Carl.
The older I get, certainly, and I imagine it's the same with you, the more you appreciate those moments.
Amen. Let's get to the good stuff. You are a longtime advocate of single-payer healthcare. Can you give us a brief explainer on why we actually cannot afford to keep our current healthcare system as it is now?
We absolutely cannot keep our current system. It is unsustainable. It has been unsustainable. We are the most expensive system in the world, with millions not having access to healthcare, with many thousands dying every year, many millions around the country filing bankruptcy. And so we do know that single-payer healthcare will be less expensive. Every reputable study shows it. We can just look to other countries and see how much they pay per capita. Everyone deserves the dignity of healthcare, and the reality is that we're all better off when everyone is healthy.
We both know how caretaking for a family member can be a deeply intimate and transformative experience. I could not survive without 24-hour care. Can you share why it's important to include long-term home and community care in progressive healthcare legislation?
My family's from India. In our culture, the elderly are very much respected. We care for them just as they've cared for us our whole lives. The idea of nursing homes even is something that is somewhat of a foreign concept, because if our elderly get old, we take care of them. I cannot imagine the idea that we live in a society that tells our elderly, who have given everything, okay, now that you're older and actually need help, you're on your own. It's unconscionable. But as you know, it's not just our seniors and elderly. You could be of any age and need long-term care or need assistance. And we have a system right now that essentially puts the burden on families. So absolutely, if we're going to talk about healthcare, we've got to talk about long-term care.
The pandemic has shown the structural failures of our current private health insurance system and has made clear how dangerous it is to tie health insurance to employment. Millions of Californians have faced job loss and financial distress, and there has been disproportionate exposure, infection, and death from COVID-19 for working people. In particular, Black, Latinx, Indigenous, and other communities of color. How has the pandemic shaped your thinking about healthcare policy?
The COVID-19 pandemic did not create our inequities. it's really exposed them and exacerbated them. What we're seeing with Black life expectancy going down 2.7 years, Latino life expectancy going down 1.9 years, and folks might say, well, yeah, they have pre-existing conditions. Folks don't like to ask the next question, why? Why do they have conditions that quicken the rate and increase the rate of them not only getting COVID, but dying from it? And so there's no doubt that this pandemic has lit a fire, not just under me, but a lot of others that are seeking justice in healthcare. Because if anyone was trying to keep it covered up before, it's all exposed now. If we don't do something about it, then we're accomplices to that pain.
I know you live in a district where there is a huge gap between the Silicon Valley tech class and the thousands of people living below the poverty line, many despite working full-time in the gig economy. How has this disparity influenced your commitment to reform our current healthcare system?
I grew up here in San Jose. I've lived here for 43 years. I've literally seen it as it transitioned from the Valley of Heart's Delight, some of the best farmland in the world, to Silicon Valley. So I've seen Silicon Valley rise up before me, so to speak. And it's exciting, but the part that doesn't get shown in this tale of two valleys are those working class families that in so many ways are the foundation. They live in my district, some of the hardest hit zip codes. Many of them work in those tech companies. They'll work as janitors, as cooks, security officers. And yet we don't see this urgency to help these families that are part of the success of Silicon Valley. We have enormous economic gaps. We have gaps in wealth that are really unconscionable. There's no doubt what I've seen over the years has absolutely informed my desire and urgency to, at the very least, bridge what I call an inhumane gap of access to healthcare right here in Silicon Valley, throughout our state and throughout our country.
I want to talk about another part of the state that doesn't get a lot of attention. In rural and other underserved areas, medical megacorporations looking to boost their profits even more have been closing hospitals and other providers of critical healthcare we need. How would a single-payer system address this proliferation of hospital closures in California?
In some rural communities in California, you have to drive hours to be able to see a doctor or certainly see a specialist that addresses your needs. And right here in San Jose, Regional Medical Center, they shut down in the middle of a pandemic. And so this is an issue that happens in rural and in urban areas. And that's because we've allowed the profiteering of our system to dictate who gets care, where they get care, and how they get care. And that's completely backwards.
Here's my last question. The people of California have clearly demonstrated that they are ready for an accessible healthcare system that accounts for all of us. What can people watching this interview do to help you make it happen?
I ask everyone to make it very clear that this is a movement that is about care and compassion for everyone. Educate others in your community, organizations you're part of, clubs you're part of, your family members, your neighbors. Then I would ask folks to communicate with decision makers. Certainly let your legislators know where you stand on the issue. We know the industry will spend a lot of money miseducating, misinforming, deceiving people. So the more we educate folks foundationally, the more individuals can withstand that onslaught of negative information that's going to be coming out. And that's how you beat a whole bunch of money.
It's really been wonderful to talk with you. Thank you for your leadership and the clarity of your moral vision.
Well, Ady, it's been an honor to talk with you. I'm so grateful for everything that you've done and continue to do to bring healthcare to everyone.
I'm looking forward to struggling together. I believe that we will win.
It's a beautiful struggle. Thank you so much, and look forward to it, brother.